let's discuss the Chinese and Western medical thought, evolution of TCM theory. Chinese and Greek medicines in distant antiquity were both dominated by the belief that illnesses were caused by spirits and demons, thus cures required the intervention of mediums or deities. In the practice of temple medicine in ancient Greece, patients slept in temples so that the gods could appear in their dreams to heal their illnesses. In China, a paradigm shift occurred with the appearance of what came to be regarded as the greatest of all Chinese medical classics, the Yongdei Neijing, also known as the Yellow Emperor's Canon of Medicine, written in the Han Dynasty. The Neijing was the distillation of ideas and knowledge compiled over several hundred years by many scholars. Although its origin is attributed to the Han Dynasty, it was continually refined, edited, and expanded right up to China's final imperial dynasty, the Qing. Hence, many editions of the Neijing exist. The Wang edition, commonly used as a reference manual, was compiled in the Tang Dynasty. The Neijing made a break with previous medical thought by refusing to attribute disease causation to numerous agents. It focused instead on environmental conditions and emotional factors and emphasized the importance of natural laws in explanation of illnesses. In particular, the Neijing brought to Chinese medicine the ideology of systematic correspondence by which all tangible and abstract phenomena could be categorized as manifestations of the theoretical models of the human body, notably the Yin and Yang principle and the five-element model. The description of anatomical and physiological system in the body, which included 5 pairs of vital organs, acupuncture meridians, also known as the channel and collaterals, and the key entities of qi, blood, and body fluids were understood in relation to those models. Different schools of thought introduced interpretations and extension of medical theory in the Neijing. These schools flourished from the Han Dynasty to modern times, although in essence, they did not depart from the core models of the Neijing. Among the earliest of these schools was the based on the treatise on febrile diseases by Zang, which postulated that the harm caused by climatic influences such as cold, wind, and dampness traveled along meridians and brought about progressive changes of the body state. During the Song Dynasty, ideas from the Neo-Confucianism, Taoism, and Buddhism stimulated the development of new medical doctrines. This followed vigorous contention among 100 schools of medical thought. Among the influential schools were those associated with Lu Yanzu, who founded the school of cooling. Stressing the elimination of excess internal heat, Li Gao, who regarded the digestive system as the fundamental basis for good health, hence founding the spleen-stomach school, and Su Danzi, who founded the Yin nourishing school, which claimed that man's body by nature tends to be deficient in yin, hence nourishing yin must be the basis of good health. These contending schools introduced differing emphasis in Chinese medicine that were in tune with the times and places in which they flourished. For example, the Yin nourishing school of Su Danzi was influential in the Yuan dynasty among wealthy officials who overindulged in food and sex, which was thought to harm the yin of their kidneys, hence the need to nourish the yin. Late Ming and early Jing saw further development of medical thought, notably studies of infectious diseases common in spring and summer in the south of the warm disorder school, led by Wu Yu Xing. Okay, this was in contrast to the cold damage model of the Shanghan Lun, written by Northerners of the Han Dynasty who endured harsh winters and develop more robust constitutions in contrast to those of delicate Southerners. The Sanghan school consequently focused in disorders originating from exposure to cold and wind and their pathogenesis, while the Wing school were more concerned with infectious diseases and epidemics that broke out in the summer months in the South. Thank you for your attention.
Let's continue with interviewing the patient, this time on temperature. This area of inquiry is used to determine how deep the pathogenic factor has penetrated into the body and whether the imbalance is hot or cold in nature, as well as to identify yin and yang imbalances. It is important to point out that in Chinese medicine, the presence of heat in the body is determined by the patient's subjective perception of their body temperature, or by the practitioner's physical palpation of their skin and their observation of skin color changes. This means that even if a thermometer reading says that they do not have an increased body temperature, if they themselves feel that they are warm or have a fever, or if the practitioner can feel that their skin is hot or see that the face, it is red, then there is heat, even though it cannot be measured physically by the thermometer. On the other hand, if they do have a measurable rise in body temperature, this is always a sign of heat. If a person feels cold or has an aversion to cold, it is important to ask them if they can get warm again by putting on more clothes or wrapping themselves in a blanket. If the increase in clothing or bedding makes them feel warmer, this is yang deficiency cold. If they are yang deficient, they will have difficulty maintaining the warmth of the body. But by packing the body into warm clothing, they reduce the heat loss and no longer feel cold. If they have an invasion of exogenous pathogenic factor, which blocks the circulation of Wei Qi, they will not be able to get warm again, even though they put more clothes on or lie beneath a duvet or blankets. This is because Wei Qi, as well as protecting the body and controlling the sweat pores, warms the muscles just below the skin. When the pathogenic factor invades the exterior, the warming Wei Qi is blocked and cannot circulate. This means that it does not help to increase the amount of clothing or bedding that is insulating the body. The pathogenic factor must first be expelled so Wei Qi can circulate before the person will feel warm again. When pathogenic factor is in the exterior as well as feeling cold and chilly, the person will often have a slight fever or feel feverish. This is because the exogenous pathogenic factor will not only prevent the circulation of the warming Wei Qi, it will also give rise to a conflict with and a stagnation of Wei Qi, resulting in the generation of heat. The difference between wind cold and wind heat is that in wind cold, there is a greater aversion to cold and little or no fever sensations, whereas in wind heat, the fever sensation is more predominant and the aversion to cold less noticeable. When exogenous pathogenic factor has penetrated the Yang-Ming aspect, it will generate a great amount of heat. This is because there is a violent struggle between the body's Chen Qi and the invading pathogenic factor. One of the most important diagnostic differentiations between pathogenic factor that is in the exterior and pathogenic factor that is penetrated to the interior is the strength of the heat and whether there is an aversion to cold. When pathogenic factor is in the interior, it no longer blocks the circulation of Wei Qi. This means that the person no longer experiences chills and muscle soreness. The fever, on the other hand, will be much more virulent. If the person experiences alternating fever and chills or an alternating sensation of heat and an aversion to cold, this will indicate that the pathogenic factor is located in the Shaoyang aspect. Qi can become lodged in this between the interior and the exterior. This results in symptoms that alternate between these two stages. Internal heat conditions can give rise to an aversion to heat, but it is not certain that the person is aware of it. Often, if you ask them how they feel, they will say that they do not have an aversion to heat or feel hot, but you can often observe that they are more lightly clad than others. A major difference between deficient and excess heat is that when there is excess heat, there is a sensation of heat throughout the day. When there is yin deficiency heat, the person will only feel warm in the evening and at night. Again, it is not certain that the person is aware of this. They do not think about whether their duvet is thinner than other people's or that they feel warm at night. Furthermore, a person with yin deficiency might not answer yes to feeling hot in the evening because they are sensitive to cold during the day because they are also yang deficient. In the evening and at night, they just feel less cold and perhaps remove the jersey that they have worn all day. Another difference between deficient and excess heat is that when there is excess heat, the whole body feels warm. When there is yin deficiency heat, the person can experience what the Chinese call 5-pound heat. In 5-pound heat, it is only the palms of the hand, the soles of the feet, and the center of the chest that feel hot. Many European patients rarely report a sensation of heat in the chest in these situations. There are also many yin deficiency patients who only feel the heat in the palms of the hand. It is important when differentiating between deficient and excess heat to ascertain whether it is the palm of the hand, yin deficiency heat, or both sides of the hand, excess heat that feel hot. A person who is qi deficient can have difficulty controlling their temperature. Therefore, they may well experience an increase in temperature on exertion. Cold hands and feet can be a sign of many different patterns of imbalance. One of the most common causes is liver qi stagnation. When there is liver qi stagnation, there is sufficient heat in the body, but the warmth cannot circulate out to the extremities. The difference between liver qi stagnation and yang deficiency is that when there is liver qi stagnation, it is only the hands and feet, and sometimes only the hands that are cold. When there is yang deficiency, it is the entire arm and leg that feel cold. The arm or leg will also feel increasingly cold the further you get from the torso. Blood deficiency and qi deficiency can also manifest with cold hands and feet because the warmth does not get transported from the torso. When a person has cold hands and feet, they might say that they feel cold or have an aversion to cold. This can create confusion when there is in reality a diagnosis of heat. One would expect that a person who has heat would feel hot, have an aversion to heat, or at least not say that they are cold or dislike cold. If they have liver qi stagnation, which may well be the underlying cause of their heat, their cold hands and feet mean that they have an aversion to cold and feel cold, whilst in reality, the body itself is warm. Now let's summarize what we have taken up. If one has aversion to cold, it signifies excess cold or yang deficiency. If there is an invasion of exogenous cold, the person will freeze no matter how much clothing and blankets they wrap themselves up in. In yang deficiency cold, a person can keep warm by wrapping themselves up in warm clothes or bedding. Aversion to heat signifies heat. Simultaneous chills and fever signifies invasion of wind heat or wind cold. If there is wind heat, the fever will be dominant. If there is wind cold, the chills will be dominant. Prolonged or intense fever indicates internal excess heat. Fever that arises in the afternoon or evening signifies yin deficiency heat. A feeling of heat that arises on slight physical exertion is qi deficiency. Alternating fever and chills means that the pathogenic factor is located in the Shaoyang aspect. 5-pound heat, hot sensation in the palm soles of the feet and chest, signifies yin deficiency heat. And finally, cold hands and feet means liver qi stagnation, yang deficiency, qi deficiency, blood deficiency. Thank you for listening.
Let's talk about the mutual consuming of yin and yang as part of our continuing discussion on the 4 principles of yin and yang. Yin and yang are in a constant state of change, so that when one increases, the other is consumed to preserve the balance. This can be easily seen in the ebb and flow of night and day. As the day comes to an end, yang decreases and yin increases. Exactly the same can be observed in the cycle of seasons. When spring comes, yin begins to decrease and yang increases. Beyond the mere preservation of their balance, yin and yang are also mutually consume each other. So when one increases, the other must decrease. For example, if the weather becomes unduly hot, which is yang, the water which is yin in the soil dries up. Thus, if yin is consumed, yang increases. If yang is consumed, yin increases. If yin increases, yang is consumed. And if yang increases, yin is consumed. In the human body, the mutual consuming of yin and yang can be seen from a physiological point of view and from a pathological point of view. From a physiological point of view, the mutual consuming of yin and yang is a normal process which keeps the balance of physiological functions. This process can be observed in all physiological processes. For example, in the regulation of sweating, urination, temperature of the body, breathing, and others. In summertime, for instance, the weather is hot, which is yang, and we sweat more, which is yin. When the external temperature is very cold, which is yin, the body starts trembling, which is yang, in an attempt to produce some heat. From a physiological point of view, the mutual consuming of yin and yang can also be observed in the alternation of yin and yang in the menstrual cycle. The menstrual cycle can be divided into 4 phases as follows. Phase 1, which is the bleeding phase. Phase 2, which is the post-menstrual phase, which is roughly a week after the end of bleeding. Phase 3, mid-cycle, or roughly a week around ovulation. In phase 4, the premenstrual phase, which is roughly a week before the period. In phases 1 and 2, yang is decreasing and yin is increasing. That is, yin increases and yang is consumed. In phases 3 and 4, yang is increasing and yin is decreasing. That is, yang increases and yin is consumed. From a Western perspective, the first 2 phases correspond to the follicular phase, and the last 2 phases to the luteal phase. Here is an illustration showing the 4 phases of the menstrual cycle, where as yang decreases in the phases 1 and 2, yin increases, and as yang increases in phases 3 and 4, yin starts to decrease. From a pathological point of view, yin or yang may increase beyond the normal range and lead to consumption of their opposite quality. For example, the temperature may rise, which is an excess of yang, during an infectious disease. This can lead to dryness and exhaustion of body fluids, which is a consumption of yin. Although some might still regard this as an attempt by the body to keep the balance between yin and yang, the body fluids and the temperature. It is not a normal balance, but a pathological balance deriving from an excess of yang. One might go further and say that the temperature itself was an attempt by the body to fight a pathogenic factor, but this does not change the fact that a rise in temperature represents an excess of yang, which leads to consumption of yin. From a pathological point of view, there can be 4 different situations of excess of yin or excess of yang, leading to consumption of yin or yang, respectively, or consumption of yang or consumption of yin, leading to apparent excess of yin or yang, respectively. It is important to note that excess of yang and consumption of yin are not the same. In excess of yang, the primary factor is the abnormal increase of yang, which leads to consumption of yin. In consumption of yin, the primary factor is the deficiency of yin arising spontaneously and leading to an apparent excess of yang. Thank you for listening.
Let's discuss the extraordinary yang organs, the brain. The brain is also called the sea of marrow. The spiritual axis in chapter 33 says the brain is the sea of marrow, extending from the top of the head to the point Phlegm-Fluids. The simple question in chapter 10 says the marrow pertains to the brain. In Chinese medicine, the brain controls memory, concentration, sight, hearing, touch, and smell. The discussion on stomach and spleen says sight, hearing, smelling, touch, intelligence all depend on the brain. The kidney essence produces marrow, which gathers to fill the brain and spinal cord. Since marrow originates from the kidneys, the brain is functionally related to this yin organ. The brain also depends on the heart, particularly heart blood, for its nourishment, so that the physiological activities of the brain depend on the state of both the kidneys and heart. So we have here the relationship between the kidney essence, marrow, spinal cord, and the brain. From the kidney essence goes to the marrow, which is the bone marrow, then fills the spinal cord and the brain. The kidneys store essence and the heart governs blood. If both essence and blood are abundant, the brain is in good health. Vitality is good, the ears can hear properly, and the eyes can see clearly. If kidney essence and heart blood are empty, the brain is sluggish, memory is poor, vitality is low, hearing and sight may be decreased. The relationship of the brain with the kidneys and heart explain how in practice certain symptoms such as poor memory and concentration, dizziness, and blurred vision can be due to deficiency of sea of marrow, that is the kidneys, or deficiency of heart blood. The spiritual axis in chapter 33 says, if the sea of marrow is abundant, the vitality is good. The body feels light and agile, and the body has endurance. If it is deficient, there will be dizziness, tinnitus, blurred vision, fatigue, and great desire to lie down. So the functions of the brain are it controls intelligence, it is the sea of marrow, and controls sight, hearing, smell, and taste. Thank you for your attention.
Let's now proceed to treatment principles, treating both root and manifestation. This approach is widely used in practice. In chronic cases, when the clinical manifestations are severe and distressing for the patient, it is necessary to treat both the root and the manifestation simultaneously. This approach is also applied when the clinical manifestations themselves are such that they would perpetuate the original problem. For example, in the case of a woman with Qi deficiency leading to excessive menstrual bleeding, Qi not holding blood, prolonged menstrual bleeding over many years will in itself lead to further deficiency of both blood and Qi. If the spleen-Yang deficiency is causing very severe and debilitating diarrhea, particularly in an elderly patient, it would be necessary to treat the root, that is, tonify and warm the spleen. But at the same time, also take active steps to treat the manifestation, that is, stop the diarrhea. In acupuncture terms, this would involve using points which are known to stop diarrhea, whatever the cause, such as stomach 25 and stomach 37. By contrast, if the diarrhea was not so severe and the patient not old, it would be sufficient to simply treat the chronic deficiency of spleen-Yang. In the case of a patient suffering from spleen-Yang deficiency causing severe edema, the correct approach would again be to treat both the root, that is, tonify and warm the spleen, and the manifestation, that is, eliminate the edema. In acupuncture terms, this would involve combining the reinforcing method to tonify the spleen with the reducing method by reducing points to move fluids such as Ren9, stomach 28, and bladder 22. In the case of a child who has severe whooping cough caused by phlegm heat in the lungs, it would be necessary again to adopt the method of treating both the root by clearing lung heat and resolving phlegm, and the manifestation by stopping the cough. This is the correct approach since the cough is very distressing and debilitating to the child. So it would be wrong to simply treat the root and wait for the symptoms to improve. This example can be compared and contrasted with the case of a chronic slight dry cough caused by yin deficiency, in which case the cough is not bad or serious enough to warrant treating the manifestation. In the case of original and deriving patterns, treating both the root and the manifestation simultaneously is a strategy that is applied very often and is indeed the most common strategy. For example, if spleen qi deficiency, the root, gives rise to dampness, the manifestation, one usually tonifies spleen qi and resolves dampness simultaneously. However, please note that when we treat both the root and the manifestation with herbal medicine, it is not a case of giving 50% of herbs for the root and 50% for the manifestation. We still need to make a conscious choice between a formula that treats the root, for example, tonify the spleen, and one that treats the manifestation, for example, resolve dampness. With acupuncture, the approach is different because acupuncture works in a different way. Acupuncture points have a broader and more neutral action. The same acupuncture point may tonify the spleen and resolve dampness, and Ren 12 would be a good example of this. Treating the root and the manifestation simultaneously is a strategy that is applied very often whenever the manifestation produces severe symptoms and signs. Thank you for your attention.
Let's continue with diagnosis according to zang for organ patterns. And for today, we'll discuss phlegm fluids blocking the lung. The difference between this pattern and the previous phlegm patterns is that here phlegm is very watery, not thick as in the previous one. This pattern often has its root in the condition of yang deficiency. Its etiology can be traced to old age and long-term physical overexertion. The ingestion of cold and phlegm-creating foods can also lead to the formation of this pattern. Repeated invasions of wind, cold, and damp can also be contributing factors. What are its signs and symptoms? Here we have cough with thin, watery, frothy sputum, wheezing, shortness of breath, superficial breathing, vomiting of white foamy mucus, aversion to cold, a fuzzy sensation in the head. There is also chest oppression, dizziness, lack of thirst, a scanty but pale urine. The patient feels suffocated if they lie on their back and must sit upright in the bed. There is bright white complexion, wet and white tongue coating, and a slippery, wiry, or soggy pulse. The key symptoms here are cough with watery sputum, cannot lie flat on their back, and there is also chest oppression. For the treatment principle, we drain phlegm fluids from the lung, regulate lung qi, and tonify the yang. In acupuncture treatment, we can choose from lung 5, lung 9, Ren 9, Ren 12, Ren 17, UB13, UB23, UB43, PD7, stomach 36, stomach 40, spleen 3, and spleen 9. For the needle technique, we can use a tonifying technique. Moxa is also recommended except on lung 5, stomach 40, spleen 9, and red 9, which should be drained. As an explanation to the choice of points, lung 9, UB13 and 43, tonify lung 3 and transform phlegm. Lung 5 drains phlegm from the lung and regulates lung 3. Ren 9, spleen 9, and stomach 40 drains phlegm and fluids. Ren 17 regulates lung 3. Ren 12, stomach 36, and spleen 3 tonify spleen yang and transform phlegm and fluids. Kidney 7 and UB23 tonify kidney yang and transform fluids. Here's a relevant advice. The advice previously for damp phlegm is also relevant here. The person should also try to strengthen their yang qi. They can do this by consuming foods that are warm and avoiding cooling foods and cooling of the body in general. Phlegm fluids blocking the lung can be caused by the following patterns of imbalance: lung yang deficiency, spleen yang deficiency, kidney yang deficiency, and an invasion of wind, cold, and damp. In turn, this pattern can result in lung yang deficiency, spleen yang deficiency, kidney yang deficiency with water overflowing to the heart. Thank you for listening.
Let's discuss diagnosis according to 8 principles. The heat. It is necessary to further differentiate between deficient and excess heat because the treatments are very different. Furthermore, it is very important to differentiate between interior and exterior heat. This is because evil qi can be dug deeper into the body by improper treatment. This is particularly important when treating with herbs. Excess heat. Excess heat will often manifest with a sensation of heat in the body or an aversion to heat. The skin will feel warm and can become red in color. Anywhere that the skin has changed color and become red is a sign that there is heat present. The heat may be localized to this area, as is seen when there is a red, swollen joint due to a local stagnation of qi, blood, and tingling when a joint is sprained. There may be heat in an organ and its channel, as is seen when there are red and bleeding gums caused by heat in the stomach channel. The heat can also be systematic, such as when there is a general condition of heat in the body. When there is excess heat, the face will often irritate as well. This is due to the yang nature, which means that it will ascend upwards in the body. When there is heat in the body, the superficial vessels become more blood-filled because the heat drives blood up to the surface, and therefore the skin appears more red in color. It is only the skin that changes color when there is heat. Exudations and discharges from the body, such as mucus in the respiratory passages and nose, discharges from the vagina, urine, fluid from ulcers, and so on, will also change color. When the secretions are yellowish or greenish, it is a sign that there is heat. Heat concentrates the exudations, and this will result in a change in their consistency. Excretions become thicker and stickier. They will also begin to smell or taste different. By driving fluids upward and outward, the yang nature of heat can result in heavy sweating. Heat can also injure the body's fluid, in which case there may be a lack of sweating. By damaging fluids and dehydrating the body, heat will result in a person having an excessive thirst with a desire for cold fluids. Furthermore, by dehydrating the body, heat can manifest with constipation. Because the body feels warm, the person will often wear less clothing than other people. A patient who turns up wearing just a t-shirt and a jacket in the winter when everyone else is walking around with sweaters and coats on, will often have excess heat. If there is pain, the expansive energy of warmth will mean that the sensation is of probing pain. This is typically seen in certain types of headaches and joints pain. The sensation can also be stinging and burning, for example, in the rectum or in the throat. Some symptoms are more specific to interior or exterior heat conditions. Interior excess heat. Some people relate the bitter taste to the heart. In reality, the bitter taste is an aspect of the fireplace as is heat. This means that the bitter taste in the mouth can be experienced in many heat disorders, for example, liver fire. Heat activates and accelerates processes. In a person with heat, this can be seen in the movements of their body, and their speech will be faster. Because interior excess heat is an excess condition, the person's voice will be loud. The nature of heat is to rise upward. This means that the heart will become agitated when heat rises upward to the upper jaw. This can manifest in both the physical plane with a faster pulse and on the mental emotional level with the person being restless, agitated, or drowning manic. Heat opens and agitates the heart, so the person will often talk quicker and be more verbose than normal. When Shen is agitated, there can be difficulty sleeping or just restless, brain-disturbed sleep. Shen and the heart can also be affected when blood, which is governed by the heart and is the residence of Shen, is agitated by heat. Heat can also result in blood becoming so agitated and overactivated so that it bursts the walls of vessels and results in bleeding. When there is heat in the interior, the heat will injure the body's fluid, resulting in thirst. The thirst seen in interior excess heat will be different to the thirst seen when there is interior excess heat. Deficient heat arises from a lack of yin, and this manifests with a dryness of the mouth and throat as opposed to an actual thirst. This means that the person will have a desire to sip small amount of liquid to moisten the mouth and throat. Excess heat will injure fluids, resulting in pronounced thirst and a desire to gulp copious amount of cold fluids. Thank you for your attention.
For depression, we continue discussing by taking into account the two syndromes in Chinese medicine, agitation and Plum-Stone syndrome. Zang, literally meaning visceral restlessness, was first mentioned in the chapter Paul's Syndromes and Treatment of Miscellaneous Gynecological Diseases of the Essential Prescriptions of the Golden Cabinet. This text says, the patient suffers from agitation, feels sad, and tends to weep constantly as if she were haunted. She stretches frequently and yawns repeatedly. The decoction of Fu Xiao Mai, Ji Chan Kao, and Da Cao can calm the patient. Plum-Stone syndrome was first described in the chapter Paul's Syndromes and Treatment of Miscellaneous Gynecological Diseases of the Essential Prescriptions of the Golden Cabinet. This text says, the patient has a suffocating feeling as if there was a piece of roast meat stuck in the throat. Use Pan Xiao Hao Pu Tang. Therefore, as can be seen, originally the symptom of Plum-Stone syndrome was compared to the feeling of having a piece of meat rather than a plum stone in the throat. The etiology of the syndrome is emotional and is due to depression. Subsequent Chinese books attributed this syndrome to the combination of qi stagnation and phlegm obstructing the throat. This type of phlegm is actually called qi phlegm, and it is the most non-substantial type of phlegm. In conclusion, the pathology of depression could be summarized as follows, with the acupuncture point suggested for each aspect and the main mental emotional aspect or organ involved. The willpower is impaired. There is lack of willpower, drive, initiative, and momentum to break out of depression. We use bladder 23, do 4, bladder 52, kidney 3. The ethereal soul does not come and go enough. There is a lack of plans, ideas, dreams, hope, inspiration, and sense of direction. So we use GB40, liver 3, GB13, bladder 18, bladder 47. Deficiency of the gallbladder's courage leads to indecisiveness. So we use gallbladder 40, GB13, do 20. Angst, anxiety, despair leads to sadness. Do 24, Ren 15, heart 7. Morbid thoughts of death, we use do 24, bladder 13, or suicidal, do 12, desire to kill people, bladder 42, 3 corpses flowing. So this is for the corporeal soul. Obsessive thinking, pensiveness, brooding, we use do 24, GB13, GB15, bladder 20, bladder 49. So this is supposed to be for the intellect. For problem in forming relationships, TB5, P7, P6, Ren 17. So this is for the pericardium and triple burner. The points mentioned above are not alternative pathologies of depression, but aspects of its pathology. Although not all of them need to be present, most of them usually are. So this is the effect of anger. It can lead to either liver qi stagnation, in which the anger is repressed, or liver yang rising, in which the anger is manifested. Thank you very much for your attention.